Today we're focusing on a topic that affects millions of men worldwide, yet remains shrouded in silence: prostate health and the warning signs of prostate cancer. It's a condition that touches lives across the globe, with over 268,000 men in the USA alone diagnosed each year. This isn't just a statistic, it's a reality that many of you watching might be facing, or will encounter as a friend, a brother, a partner, or a parent. That's why talking about this is so crucial. Early detection of prostate cancer can dramatically alter the course of treatment and significantly improve outcomes. Recognizing early symptoms can lead to timely medical intervention, which is key in managing the disease effectively. But beyond the clinical aspects, understanding these warning signs can bring peace of mind and empowerment. It's about taking control of your health, being informed and proactive. This video is designed not just to inform, but to connect with you on a personal level. We're here to discuss not just the what, but the why it's important for you or someone you love to pay attention to their body's signals. Stay with us as we delve into the 10 warning signs of prostate cancer that everyone should know. Whether for yourself or someone close to you, knowing these signs could be life-saving. Warning sign number 1, difficulty urinating. One of the first warning signs of potential prostate issues, including prostate cancer, is a noticeable change in urination patterns. This can particularly manifest as difficulty in starting urination or struggling to hold back urine. Normally, urine flows freely, smoothly, and without much effort from the bladder through the urethra. However, the prostate gland, which surrounds the urethra, can become enlarged or inflamed due to cancerous growths, thereby affecting its function. When the prostate enlarges, it can press against and constrict the urethra, leading to a disruption in the flow of urine. This might result in several urinary symptoms: a weak or slow urinary stream, a feeling that you cannot completely empty your bladder, urgency that interrupts sleep, or difficulty starting the process of urination. These symptoms should not be ignored as they can be early indicators of prostate cancer. Early medical evaluation can lead to timely diagnosis and management, significantly impacting the effectiveness of treatment. Ignoring these signs may allow the disease to progress, complicating treatment options and outcomes. Awareness and proactive health checks are your best defenses against the progression of prostate cancer. Warning sign number 2, decreased force in the stream of urine. A common and noticeable sign of potential prostate issues, including prostate cancer, is a decreased force in the stream of urine. When the prostate, a small gland surrounding the urethra in men, becomes enlarged or inflamed due to cancerous cells, it can press on and narrow the urethra. This pressure restricts the flow of urine from the bladder through the urethra to the outside of the body. This restricted flow results in several symptoms, the most apparent of which is a weakened urine stream. Men may notice that they have to strain to urinate, a significant change from their usual pattern. This straining can not only be uncomfortable but also harmful over time, leading to additional complications like bladder stones or infections due to incomplete emptying of the bladder. Such symptoms should not be dismissed as merely age-related changes. While benign conditions like benign prostatic hyperplasia, BPH, are more commonly behind such symptoms, prostate cancer can also present similarly. Early detection and treatment are crucial as they can prevent further complications and allow for more effective management of the condition. Warning sign number 3, blood in urine. The presence of blood in the urine, known medically as hematuria, is a serious symptom that should never be overlooked. This alarming sign can be an indicator of several health issues, including infections, kidney stones, or injuries to the urinary tract. However, it is also a significant warning sign of more serious conditions like prostate cancer. When prostate cancer advances, it can invade the nearby tissues or even the urinary tract itself, leading to bleeding. The blood may not always be visible to the naked eye. Sometimes it's only detectable under a microscope. However, in cases where the blood is visible, it can give the urine a pink, red, or even brownish tint. Regardless of the amount of blood, the appearance of any blood in urine is a signal that something is wrong. This symptom requires immediate medical attention for several reasons. Firstly, diagnosing the cause of blood in the urine can lead to early detection of potentially life-threatening conditions such as prostate cancer. Secondly, early intervention can significantly improve the outcome and the range of treatment options available. Lastly, addressing this symptom promptly can also prevent further complications that may arise from the underlying cause. Warning sign number 4, blood in semen. Finding blood in semen, a condition known as hematospermia, is an alarming and unsettling symptom that should not be ignored. While it can sometimes be benign and occur without any serious underlying condition, especially in younger men, it is also a potential indicator of more serious health issues, including prostate cancer. Blood in semen can result from a variety of conditions affecting the male reproductive system. These include infections or inflammation of the prostate, prostatitis, seminal vesicles, or urethra. Other causes might include trauma, recent surgical procedures, or even the rupture of tiny capillaries during ejaculation, which is usually harmless. However, when this symptom occurs in men over 40 or persists over time, it can be a sign of more serious conditions like prostate cancer or other malignancies in the reproductive system. The presence of blood in semen due to prostate cancer typically indicates that the disease might have affected the prostate gland or nearby tissues significantly, thus disrupting normal functions and causing bleeding. Because of the potential seriousness of the underlying causes, any instance of hematospermia warrants a consultation with a healthcare provider. A healthcare provider can perform a thorough evaluation, including a physical examination, and possibly order diagnostic tests like urine tests, ultrasound, or MRI to determine the exact cause. Addressing this symptom promptly ensures appropriate management and treatment, particularly if it's an early sign of a significant medical issue such as prostate cancer. Warning sign number 5, persistent pain or stiffness in lower back, hips, or upper thighs. Persistent pain or stiffness in the lower back, hips, or upper thighs can be particularly concerning as it may indicate that prostate cancer has progressed beyond the prostate gland itself. This type of chronic pain is significant because it might suggest the cancer has metastasized or spread to the bones, a common site for prostate cancer metastasis. Metastatic prostate cancer in the bones can cause pain and stiffness due to the growth of cancerous cells within the bone tissue. These cells disrupt the normal balance of bone building and breakdown, leading to weakened bones, increased fragility, and sometimes painful lesions. The areas most commonly affected include the pelvis, spine, and ribs, which can manifest as persistent, nagging discomfort that does not improve with rest and may worsen over time. This symptom is a critical warning sign because bone metastases from prostate cancer are an advanced form of the disease and can significantly affect a patient's quality of life and overall prognosis. The pain might be dull or sharp, and it can be severe enough to impair daily activities and diminish life quality. A healthcare provider may use imaging tests such as X-rays, CT scans, MRI, or bone scans to investigate the cause of the pain and to check for the presence of cancer in the bones. Warning sign number 6, painful ejaculation. Painful ejaculation is an important symptom that can indicate underlying prostate problems and should never be ignored. This discomfort can manifest as a sharp, burning, or painful sensation during or immediately following ejaculation. It's not only distressing but can also significantly affect sexual health and quality of life. The prostate gland plays a key role in the male reproductive system, including the secretion of fluid that makes up a significant portion of semen. When the prostate is inflamed, infected, or affected by cancer, it can lead to painful ejaculation. Conditions such as prostatitis, which is inflammation of the prostate, or prostate cancer, can cause swelling or irritation in the area, impacting normal function and resulting in pain during ejaculation. Moreover, painful ejaculation can be a symptom of more advanced prostate issues if cancer cells begin to affect nerve pathways or other structures within the pelvic region. This pain might not be isolated to the act of ejaculation, but could also occur during other sexual activities or even persist after sexual activity has ended. A healthcare provider can conduct a thorough assessment, which might include a physical examination, urine tests, and possibly imaging studies or a prostate biopsy if cancer is suspected. By diagnosing the underlying cause, appropriate treatments can be initiated to manage symptoms effectively and address any serious conditions like prostate cancer. Addressing this issue not only helps in managing the physical discomfort, but also assists in maintaining overall sexual health and well-being. Warning sign number 7. Frequent pain or stiffness in lower back or hips. Frequent pain or stiffness in the lower back or hips can be particularly troubling, as it often signals more advanced prostate issues, including the potential spread of prostate cancer to the bones. This symptom is commonly associated with bone metastases, where cancer cells travel from the prostate to bone tissue, predominantly affecting the spine, pelvis, and hips. Bone metastases disrupt normal bone remodeling, a balanced process of bone breakdown and formation. Cancer cells interfere with this balance, leading to weakened bones and the development of painful bone lesions. The pain experienced is typically persistent and may not alleviate with rest, often worsening at night or with physical activity. This discomfort may manifest as a dull ache or sharp bursts of pain, depending on the extent of bone involvement and the specific areas affected. The presence of these symptoms in men, particularly those with a history of prostate cancer or those at risk, warrants immediate medical evaluation. Advanced prostate cancer that has spread to the bones is a serious condition, That significantly impacts a patient's prognosis and quality of life. The management of such symptoms typically involves a multidisciplinary approach including pain management, hormonal therapy, chemotherapy, radiation therapy, or even surgery in certain cases. Medical professionals may use various diagnostic tools such as bone scans, MRI, CT scans, or PET scans to detect the extent of bone metastasis and guide treatment decisions. Addressing the underlying cause of the pain not only helps in alleviating the discomfort, but also plays a crucial role in the overall management of advanced prostate issues. Warning sign number 8, unexplained weight loss and loss of appetite. Unexplained weight loss and loss of appetite are significant symptoms that can sometimes indicate the presence of cancer, including prostate cancer. When these symptoms occur without a clear reason, such as changes in diet or exercise habits, they should be taken seriously and investigated further. In the context of prostate cancer, sudden weight loss and a decreased appetite could be signs that the cancer has advanced and is affecting the body more systemically. Cancer can alter metabolism and reduce muscle mass, leading to noticeable weight loss. Additionally, substances released by tumors may suppress appetite or change the way the body processes nutrients, contributing further to weight loss. The impact of these symptoms extends beyond physical health. They can also affect emotional and psychological well-being, reducing a patient's strength and ability to cope with other symptoms or treatments. This can create a cycle where a lack of appetite leads to weight loss, which in turn decreases energy levels and the overall quality of life. Warning sign number 9, fatigue. Fatigue is a common symptom that many people experience at some point due to various reasons, including stress, poor sleep, or overexertion. However, when fatigue becomes persistent, severe, and not alleviated by rest, it warrants closer attention as it can be associated with more serious health conditions, including cancer. In the context of prostate cancer, fatigue might not only result from the cancer itself, but also from the body's systemic response to the disease. Cancer-related fatigue is particularly profound and debilitating and differs from ordinary tiredness. It's a type of exhaustion that doesn't improve with rest and can severely impact daily functioning and quality of life. The mechanisms behind cancer-related fatigue are complex and can involve a combination of factors. The cancer can cause increased metabolic demand as the body fights the disease, while at the same time producing substances that lead to fatigue. Additionally, other symptoms like pain, emotional stress, and the side effects of cancer treatments, such as chemotherapy, radiation, or hormonal therapy, can all contribute to or exacerbate fatigue. Because fatigue is a common symptom across many conditions, it can be overlooked or dismissed as less serious. However, if someone with a history of prostate cancer or at risk for it experiences unexplained, persistent fatigue, it's crucial to speak with a healthcare provider. Warning sign 10, swelling in legs or pelvic area. Swelling in the legs or pelvic area is a concerning symptom that can arise from the spread of prostate cancer, particularly when it reaches an advanced stage. This swelling, often referred to as edema, typically results from cancer spreading to the lymph nodes, or from the cancer obstructing lymphatic or venous drainage pathways in the pelvic region. When prostate cancer metastasizes to the lymph nodes, particularly those in the pelvic area, it can block the normal flow of lymphatic fluid, which is crucial for transporting waste and immune cells through the body. This blockage causes fluid to accumulate, leading to swelling in the legs, ankles, or pelvic area. Additionally, if the cancer grows large enough to press against blood vessels, particularly the veins, it can impede blood flow back to the heart, causing further fluid buildup and swelling. This type of swelling is not only uncomfortable but can also lead to other complications such as pain, increased risk of infection, or decreased mobility. It is an indication that the cancer has progressed and may be affecting the body more systemically, necessitating prompt and aggressive management. Healthcare providers can conduct a thorough evaluation, including imaging studies like CT scans or MRIs, to assess the extent of the disease and determine the best course of treatment. Managing the underlying prostate cancer is key to alleviating the swelling and preventing further complications. This may involve a combination of therapies such as surgery, radiation, or chemotherapy, aimed at reducing the tumor burden and relieving the obstruction causing the swelling. Recognizing the warning signs of prostate cancer is crucial for early detection and treatment, leading to significantly better outcomes. If you notice symptoms such as difficulty urinating, blood in urine or semen, persistent pain, unexplained weight loss, or swelling, don't hesitate to consult a healthcare provider. Early intervention can save lives. Stay hopeful. Many advances in treatment have been made, and catching the disease early enhances the effectiveness of these treatments. If you found this information valuable, please subscribe for more health-related content and share this video with friends. and family to help spread awareness and potentially save lives.